Bismillah ar-Rahman ar-Rahim wassalatu wassalam ashraf al-mursaleen. We're going to talk about inshallah how to fill the postpartum clinical sheet. It's pretty straightforward, but I understand that because you just start the clinical rotation of maternity courses, I think it's pretty useful if we go over each definition, each term, and abbreviation. So as you can see here, your name, your group, if you have like A1, A2, PC, whatever, and the date, the date you took the case and you start taking care of it as a student. Personal data start with the mother's initial. Of course, we don't write the patient's name or medical report number, age, nationality, date of admission, occupation, and hospital ID. I'm going to delete it right now. We do not write any identifiable data for the patients. Occupation, education, and when did she deliver the baby? Okay, so medical surgical history, we start with we're just giving you an examples. Mellitus D, diabetes mellitus, GDM, heart disease, hypertension, anemia, or kidney disease, and also we're giving you an option of others. So, which means she might have other medical condition. It's not listed over here, and the conditions listed here is just to help you to understand what we are talking about. Surgical history. Definitely, if she has a surgical history, we're gonna list what kind of operation and surgery does the mother have. Major, minor, it can mention in this area. Family history, we mentioned diabetes mellitus and hypertension because are the most common comorbidities in Saudi Arabia, but definitely you have another option to mention the rest. Obstetric history, we started with gestational age, and by this time I'm assuming you know what is gestational age after taking the first lecture in the maternity course. Number of living children, delivery date and time, we're talking about the last delivery of this admission, gravida and para. So remember that postpartum means after delivery. Postpartum means after delivery. So you are filling this report in a postpartum delivery. So postpartum unit, when the mother delivered their baby and they transferred, they are doing well to the postpartum floor or unit or ward, whatever the place call it. And we're talking about here about the gravida, the number of gravidas and the number of the para, and you will know what's gravida and what's para from the lecture, inshallah, when you take it. Date of the last delivery, the current delivery, and what was the type: spontaneous vaginal delivery, cesarean section, or assisted delivery. And we will understand the difference between each term just briefly. SVD, spontaneous vaginal delivery, normal delivery; CS, cesarean section, operative delivery; assisted delivery, if the mother if the physician, obstetrician, or the midwife had to use a certain type of instrument during delivery, such as forceps and vacuum, it will be considered assisted delivery. And length of labor is very important because in the lecture we're gonna talk about the normal labor and delivery. And normal labor and delivery, it has an average of duration for primary gravida and for multi-gravida, and that's why we ask about the duration or length of labor. Blood type and RH is pretty important. We are looking here if the mother is having RH negative, and that indicate RH incompatibility in the future and she needs further management. Okay, so and also for the previous obstetric history and previous obstetric history, we are going to talk about previous problem like antepartum hemorrhage. Thank you. Antepartum hemorrhage, if she has any hemorrhage during early or late pregnancy. And again, there is a specific lecture, detailed one we're gonna take, and we're gonna talk about abnormal bleeding during pregnancy. Preeclampsia, we're gonna know what's preeclampsia, what's the criteria. that we have to consider when the doctor diagnose preeclamptic patients, and eclampsia, which is a very complicated form of preeclampsia, which means having seizure during pregnancy or labor. And also there is polyhydramnios, the excessive amount of amniotic fluid around the baby. But keep in mind, these are only examples. So sometimes the women, they have other kind of complication or problem, which it's not listed here. Okay, the previous postpartum complication. So now here again we're talking about history, postpartum hemorrhage. We're going to have a specific detailed lecture about it. Postpartum blues, postpartum depression, postpartum. We're not going to go further in that, but also we're going to take a detailed presentation about this topic, postpartum infection, and definitely there are other complications the mother might have during postpartum period. That's why we left an others option for you here. In the general examination, actually this is a lab by itself. We're gonna inshallah cover it in the lab, how to do postpartum assessment for women recently delivered their baby. So we are just here having this table to help you to go through the examination. We're gonna start with breast and nipple, abdomen and fundus, lochia, perineum, lower extremities, bladder, bowel elimination, incision if applicable. We're talking about incision here, most likely a cesarean section. Incision if the mother delivered via CS, and psychological adaptation of the mother, rest and sleep, and breastfeeding patterns and behavior. And you will add right here your normal findings, what we are expected to see, the findings during postpartum period, and what is your finding for that patient. So the reason we have two section is we want to make sure that you understand the normal finding of physical examination for a normal postpartum period compared to what you find or what you will find in your patient when you take care of it. So it's pretty easy, straightforward. There should be an extra information, needed information about blood work or investigation, sometime added. So we have to go through it. If it's blood urine analysis was done, other blood tests was done during the postpartum periods, like CBC and what other lab works it's needed for that woman. And also in addition to that, the medication sheet. So in the medication sheet, it's always allocated on the blackboard, and in the blackboard we have the medication sheet, which is a table about, you will list the medication that the patient's taking, the name, the category, mechanism of action, the dosage, and the route that the patient received the medication, and the side effect and nursing intervention. Last, nursing care plan. And the INIS nursing care plan, it's also one of the requirements for postpartum patient. We have a specific table also attached separately, a document in Blackboard. It's just a table for the nursing process, and also there will be a rubric for nursing process, how the professor is going to grade your nursing care plan based on the rubric. So for this part, you need to go back to the clinical instructor, because some of the clinical instructor might require two actual nursing diagnosis or high risk potential nursing diagnosis, and it's based on the professor clinical instructor request, and definitely based on the finding that you get from the history and the physical examination from your patient. Thank you so much, and I hope